Now the case count is climbing in the growing parasite outbreak. Maryland is now reporting 69 cases of cyclosporiasis, more than twice as many as last week. And nationwide, more than 1,600 cases have been confirmed as health officials work to pinpoint the source. Now, if you're heading to the grocery store, there's no need to panic.
That's right. But health experts say, look, it's a good time to be extra careful with fresh produce. Our Marcella Robertson is joining us now with all the details that you need to know. There's just a lot of questions around this. Marcella, good morning.
Yeah, so many questions. Good morning to you both. Good morning to you at home. And of course, this is all that people are really talking about, right? But investigators, they are racing to find the source of this growing outbreak. Cyclospora is notoriously difficult to track, but experts say that funding cuts have not made the job easier. I spoke with a food safety expert about what you should know before your next grocery run.
The growing cyclospora outbreak has sickened thousands of people across the country. While investigators suspect leafy greens or bagged salads may be involved, they still haven't been able to pinpoint one clear source.
It could be something in that salad.
Barbara Kowalczyk heads the Institute for Food Safety and Nutrition Security at the George Washington University.
Or, honestly, it could be an entirely new vehicle that we haven't even thought of yet.
That's left many shoppers asking the same questions. What should I be buying and what should I avoid?
I would potentially think about maybe cooking my vegetables, staying away from maybe bag salads. Right now, definitely washing. That won't eliminate risk, but it will reduce it.
Cyclospora is a parasite that typically causes severe diarrhea, stomach cramps, and fatigue. Symptoms usually don't show up until 1 to 2 weeks after eating contaminated food, making it especially difficult for investigators to track down where it came from.
It's hard to remember what I ate last week, let alone what I ate 3 weeks ago.
The outbreak is also highlighting concerns about tracking foodborne illnesses in the U.S. Kowalczyk says public health agencies have been left with fewer resources.
In the past couple of years, there's been further cuts to public health funding that makes it really even harder to respond to events like these.
She says investments in food surveillance over the past 30 years have helped investigators find outbreaks before they grow too large.
My concern is that we are unraveling that and we're going to go back to having only catching big fish again and only really seeing the big outbreaks. And this is a big outbreak.
So why the focus on potentially lettuce or salad greens? Well, experts say one of the biggest clues for investigators is who is getting sick. Most cases have been adults. And we know kids eat a lot of berries, and because that age group has not really been impacted, that is what really points to foods like leafy greens or maybe even fresh herbs. So again, Simone, really just a theory, but the expert that I spoke with there says that could mean potentially because of that age group that berries are not part of this. So certainly still a lot of questions to answer in this.
You touched on something so important, which was the incubation time for symptoms, anywhere from 2 to 14 days, a week to 2 weeks. And then on top of it, if you think you have it, you have to request a specific test from your doctor so then they can treat you. So something to keep your eye out for. Just making a lot of people nervous right now. Appreciate your reporting on it, Marcella. Thank you.